Monica, and a picture's worth 1,000 words. One of his clients was kind enough to allow us to watch Bruce's examination and treatment of her. The session started with an intake interview.
Is for some help with your low back.
Right. I've been experiencing a little back pain, and one of my legs kind of is sore, and it's been going on maybe for 3 weeks, and I've heard that you might be able to help me.
Yeah, I'd be more than happy to try to see if we can stretch it out and get you back into alignment, take some pressure off that nerve perhaps, and just get you better balanced on both of your feet. Welcome to the office, Vicki. As we start the visual analysis, I'll look down in your feet and look for symmetries and asymmetries. The first one that we see would be over on your left leg in terms of where your knee and your patella are. Your left leg is a little bit more dead center, it's right in the middle. Your right leg is a little bit rotated away from midline, so your patella looks like it's facing away from the middle of your body, different from the left side. As we come up your body from there, the next asymmetry that I see that stands out is in your hands. The left side in your hands, it's a little bit higher here, and the right side hangs a little bit lower. And you can see the corollary to that where your shoulder here on the left side is a little bit higher than your right side where your shoulder is a little bit lower. And then up into your head and cranium, there's a little bit of a right side bend in your skull. Your eye looks a little bit lower, your earlobe looks a little bit lower on the right side. So that concludes the visual analysis part. We'll move over to the table and you'll just lay on your back with your head at this end of the table and your feet just off the edge at the other end.
And one of the things that's important as we work with people as they change postures and what their habits go into, that we like to give them support. What is their bed like? But in this particular case, what creates ease in their body as we're evaluating for their alignment.
So I'm looking at your leg length here, Vicki, and it's a little bit shorter on the right side.
Okay.
Check the mobility, your left, your right leg. It's a little bit tighter over on the left. Here I'll test your sacroiliac joints for their motion.
Okay.
Compare them left to right. How does it feel to you in here?
It feels a bit tighter on the right to me.
It feels tighter on the right to me also. This part addresses the viscera, motion of your ribs on your stomach and spleen on the left versus your liver on the right, and it's also a little tighter on the right. How does that feel to you, left to right?
It's just a little sore, but I don't feel the tightness on the right side that you mentioned.
Pressure's still okay?
Yeah, it's fine.
Left side, right side. Does one side feel tighter to you than the other?
The right is tighter.
How's this pressure, Vicki?
That's good.
Okay, I'm going to stretch this side out a little bit. Tell me if you get uncomfortable in any way.
Okay.
It's a slow stretching out process, very similar to yoga in that way. So how are you feeling now from the beginning of the session? Do you feel any different?
I do. I feel there's less tension in my low back. I feel like my energy is less scattered and more rooted, I guess I'd say.
I think we're off to a good start.
So do I.
Bruce, that kind of struck me that it started as sort of non-specific complaints, and yet you were tracking down where the problem areas were. At the end of this, do you give the patient exercises or therapies or an alternative even to the way of getting out of bed in the morning? Is that kind of what you're about?
Yeah, I try to follow up the manipulation part in the office with modifying what you're doing outside of the office. So everything from adjusting the ergonomics at your computer and at your desk space, your sleeping, and your workouts. Those are probably the top 3 areas that I try to focus on to help people out and so they can help themselves out.
Gail, I know it's very easy to sort of drop out of good health habits. A person can be, or they can have a month of stress and suddenly they're doing things differently. Do you need to identify some of those things as well when your patients and perhaps get them back on track?
Oh, yeah. Frequently they'll come in and, again, the chairs that we choose. You know, maybe they've retired and they're working a little bit more with computers, but the things that they choose gets them into the possibility of slouch type postures.
Can't you just hear your mother, stand up
Yes.
straight? You know?
Yeah.
You wonder
So-
about that, but I can see that happening. And often people don't change the things they need to change. Oh, I can manipulate my computer just fine. I don't need those rests for my
Yes.
wrists.
Yeah.
Yeah.
So
So-
we help them with all of that. We even go to their homes and see what their stations are like.
Right.
How can we give them hints and being
See,
able
I
to
think that's
provide-
really important because
Yeah.
you could see if they have placed, for example, small kitchen appliances at the wrong level and made their life difficult unnecessarily.
Yeah.
Or checking how their bed system is. We need to take a short break. So when we come back, we will continue our discussion of integrative manual therapy and aging. We'll be right back. Welcome back to Aging in LA. Our topic today, integrative manual therapy and aging. Our guests are Bruce Schonfeld, who practices the art and science of hands-on manipulation for therapeutic purposes, and Gail Wetzler, a physical therapist who heads up the Wetzler Integrative Physical Therapy Center in Newport Beach. Thank you again, Bruce and Gail, for joining us. I really do find this fascinating because it expands the notion of wellness. It's not just when things are, or when the wheels have fallen off. You are actually taking proactive steps to help get rid of some of the stresses and strains of life. Yes?
Yes.
You-
Yes. And I'd like to say that one of the key things to help people is that they listen to their body, and it shares so much with them if they really listen deep inside to what is happening, and they can take some direction with that. And to keep it simple, you know, we talk about ergonomics and body mechanics and posturing, and really believe in yourself, an inner knowing, and you can change. It's just such an old adage as you age, the posturing goes and the deformation that occurs. I've worked with so many people with such a wonderful attitude, and the body can recreate those cells to make change in their structure as well.
Well, and Bruce, would you agree with me that this is a good topic to at least think about so that you can be paying attention to those signals that your body is giving you all the time?
Yeah, it's a great topic. Unfortunately, no one ever educates us how to listen to our body when we're doing our early schooling. So a lot of the transition that Gail and I and people like us help people make is you stop suppressing the pain signals and you start listening to them or the signs of discomfort. And you try to figure out when your body is starting to get in a little bit of trouble as early as possible, so that if you're at a movie, you get up and go in the back and stand up and stretch instead of just staying in your seat and hurting your low back, for example.
Right, and I can see that on airplane travel or any long stretch.